Hi, and welcome to Blue HIV. My name is Rita Riddick-Seels, and I am a family nurse practitioner and an HIV/AIDS specialist. I created this podcast in order to bring awareness to HIV/AIDS. The first subject I would like to speak to you about is what I call a secret weapon, and it is called PrEP. PrEP stands for pre-exposure prophylaxis. The reason I call this a secret weapon is because I have had the opportunity to speak to numerous people, whether they were my patients, a friend, a family member, or a stranger, and they have never heard of PrEP. PrEP was approved in 2012 by the FDA for the use of lowering a person who has HIV negative chances of becoming positive through sex by greater than 90% and through injection drug use by 70% or greater. It's a little blue pill that you would take every day if you are HIV negative. And like I said, it lowers your chances of becoming HIV positive through sex by 90% and through IV drug abuse by 70% or greater. Now, this concerned me so much because the population that's being affected by HIV the most is the population that I speak to the majority of the time, which is the African American population. They are most affected by HIV, but they seem to not be aware that there is a medication that you can take that will lower your chances of becoming HIV positive, like I said, by 90% or greater. And it's been approved since 2012. Some of you may have seen the commercials that they have out there for the medication called Truvada, which is the medication you take to lower your chances of becoming HIV positive. But I don't think there's enough information out there, because if there was, then more people would be aware of it. Now, they're recommending the people that are in high risk relationships take this medication. Now, let me explain to you what they say and what we consider high risk relationship. If you are in a relationship and your partner is HIV positive, if you're in a non-mutual monogamous relationship with a gay or bisexual man, and you have anal sex without using a condom, or been diagnosed with an STD, which is sexually transmitted disease, in the past 6 months. Also, a heterosexual man or woman who do not use condoms regularly and is not aware of their HIV status, are at high risk for getting HIV infection. Now, most of us can relate to what I just said. Heterosexual, man or woman, who do not use condoms regularly, and they're not aware of their HIV status. This is considered high-risk behavior, okay? A person who injects drugs and shares needles or works within the last 6 months is also high-risk behavior. Now, I hope I got you guys thinking. If you are in a mutual monogamous relationship, that means you and your partner are only having sexual intercourse with each other, not including the side chicks, the mistress, the booty calls, or the down low relationships. Y'all just having sex with each other and no one else? If that is true, then PrEP is not for you. You are not in a high risk relationship and you've already tested negative, then this conversation does not relate to you, but may relate to someone that you know. Listen, it's like driving a car with no seatbelt. If you just never know when you may have that head-on collision. And what I mean by that, you go in, you meet someone, I've heard this statement. They seem clean. I don't have to use a condom. And then you have that head-on collision by having intercourse without using a condom. You're putting yourself at risk for contracting HIV. Now, despite the low levels of PrEP awareness through knowledge dropping with my family, with my friends, everybody that I can speak to, it just seems like it wasn't enough for me. I needed to bring awareness to this on a broader spectrum. So I chose this podcast to do this. Hopefully, what I just said to you, you will pass it on to a friend, to a family member, to anyone that will listen to you, that there is a medication out there that can lower your chances of becoming HIV positive through sexual intercourse by 90%. Why take the chance of becoming positive when we have something that can help you not become positive, along with condoms? Let me not leave that out, because there's more to worry about than just HIV. You can go to your primary care provider. You can go to the health department, your local health department, and they can give you information on it. And your primary care provider should be able to provide this medication for you. If not, they can refer you to someone who can. Thank you for allowing Blue HIV to provide you with healthy sex talk. Remember, Blue is an acronym. B stands for Be Tested, which equals identifying and treatment. L stands for lowering high-risk behavior, which equals less transmission. U stands for undetectable, which equals untransmittable. And E stands for eradication, equals elimination. And that's what we want, elimination. Remember, choose healthy sex choices. Thank you.